Hey y'all, welcome. We're here to talk about leukemia, the different types, the prognosis, the treatment, side effects, and resources. We're glad you can make it because we all know that you have some kind of loved one that you're taking care of that has leukemia. My name is Shelby.
Emily Nieves.
Laura Barton.
Shalay Lawson.
Young Zhao.
I have a handout going around just to talk about the different types of leukemia, the treatment, and just a small overview of what we're going to be talking about. So we're hoping when you leave here that you're going to be able to identify the 4 different types of leukemia based on their pathology and prognosis, that you'll be able to understand some different treatment methods as well as kind of the plan of care, that you'll be able to talk about the common side effects, what their signs and symptoms might be, and some kind of abnormal lab values that you might see. Also that you'll be able to manage the side effects, so what kind of alternative therapies you might be able to use, and also resources that might be available to you that you might need.
So what is leukemia? Leukemia is a disease that occurs when stem cells in the body's bone marrow start to produce immature white blood cells that have an issue functioning normally. There are 4 main types of leukemia: acute lymphoblastic, acute myeloid, chronic lymphocytic, and chronic myeloid. Acute lymphoblastic, it is an abnormal growth of marrow cells that form lymphocytes. It progresses rapidly and normally affects children. The other 3 usually affects adults. Acute myeloid usually involves unusual growth of marrow cells that form red blood cells, white blood cells, not including lymphocytes, and platelets. It progresses rapidly. Chronic lymphocytic is the same as chronic lymphoblastic, except it progresses slowly. Chronic myeloid is the same as acute myeloid, except this one involves the Philadelphia chromosome and it progresses slowly. Prognosis. ALL and AML, almost 90% children diagnosed with the disease are cured. Adult patients treated for ALL have 80% to 90% chance of attaining remission. About 40% of those who do survive at least 5 years have a chance of full recovery. Patients treated for AML have a 60% to 70% chance of remission. About 30% of those survive at least 3 years with the possibility of full recovery. CLL, there may be many years before they need treatment. The 5-year survival rate for those diagnosed is 82%. CML, more than 70% of men and 75% of women will survive for 5 years or more after being diagnosed. Between the ages 15 and 64 have 90% chance of survival rate, and after the age of 65, they have a 40% chance of survival rate.
So there are many different types of treatment methods and plans of care. Cancer treatment is mostly focused on removing or destroying cancer cells and preventing the continued abnormal growth of the cells. So chemotherapy is the most common type of chemo used for leukemia. Chemotherapy is a drug treatment that uses powerful chemicals to kill the rapid dividing cells or damage the cell's DNA so they can stop growing and multiplying. Chemotherapy can be used by itself or also in combination with other treatment methods. Chemotherapy is usually given by mouth as a pill, or it can be given as an IV medication through the patient's central line or port, or it can even be given as a shot. Chemotherapy can be given in a hospital, the physician's clinic, or sometimes even at home. Most chemotherapy drugs are cytotoxic. That means that they're toxic to all cells. So they work to kill the cancer cells, but they also unintentionally kill the healthy cells as well, which lead to many of the side effects of chemotherapy. Radiation therapy is another way to kill or damage the cancer cells. It's usually given by a machine, kind of like an X-ray, but the radiation is just much stronger. Radiation is going to be used in combination with chemotherapy or only used in certain situations with leukemia. So it could be used to try to prevent or spread of leukemia to the brain or treat the testicles in boys if the leukemia has spread to those. Radiation is also going to be used to give radiation to the entire body to help with stem cell transplant and destroying all of the cells in the bone marrow. So bone marrow and stem cell transplants. Stem cells are immature blood cells that are found in the bone marrow and blood. These are going to be your red blood cells, white blood cells, and platelets. Stem cells and bone marrow transplants are used to replace the stem cells that have been destroyed by the cancer or destroyed by the chemo and radiation used to treat the cancer. High doses of chemotherapy along with radiation kills all of the stem cells in the bone marrow, and then the stem cell transplant is going to replace those cells with healthy blood-forming stem cells. The main difference between a stem cell and a bone marrow transplant is whether the stem cells were retrieved from the blood or from the bone marrow itself. So supportive therapy, cancer treatment is hard on the body. A main treatment goal is to prevent problems that may be caused by low blood counts. So a patient may have a low red blood count, and that's going to cause severe fatigue. Getting a blood transfusion can help the patient feel better and allow them to be more active. Low platelets can cause bleeding problems, so a patient will benefit from a platelet transfusion to prevent other complications with bleeding. So your treatment's going to be in phases. It's usually 3 main phases: the induction, the consolidation, and the maintenance phase. The induction phase is usually in the first month, and that's to hopefully receive remission. Just because you receive remission does not mean that you are cured. This is why the cancer treatment continues even after the induction phase. This just means that the leukemia cells are no longer found in the bone marrow samples. Consolidation phase is more intense and starts once the remission phase is over. This is going to last several months, and several drugs are going to be used and combined to help prevent the remaining leukemia cells from creating resistance. And your maintenance phase is going to be where you're going to come in once a month or so, or every 4 weeks to receive your treatment, and it's after the induction and consolidation phase. This is where when the maintenance phase begins. Everyone is different, and every cancer treatment is going to be individualized. It is best to talk with your doctor about which plan is best for you and your cancer treatment.
Okay, now I'm going to talk about the side effects that you might have from the therapies. First, the chemotherapy and radiation therapy can give you maybe hair loss, like in the picture here, and mouth sores, loss of appetite, nausea, vomiting, and diarrhea or constipation, infection, anemia, bleeding, or fatigue. The stem cell transplant. Shortly after your stem cell transplant, you might have mouth or throat pain, nausea, vomiting, infection, bleeding, or lung problems, like it's called pneumonitis. And then you might develop graft versus host disease. I'm going to explain about it later. And side effects you might see later after the transplant is infertility, pneumonia, cataract, relapse, or you might develop another new cancer. Blood transfusion. You might develop blood-borne infections, but this is extremely rare, and examples are hepatitis C, B, or HIV. Hemolytic reactions. This is coming from burst of your red blood cells, so you might have shortness of breath, or confusions, or jaundice, fever, dark-colored urine. And this graft versus host disease, you might develop rash, burning, redness of the skin on palms and soles, nausea, vomiting, stomach cramps, diarrhea, jaundice, weight loss, decreased appetite, and maybe your skin feels tight, dryness, or painful sores in the mouth. And these are the lab values, and you see here's normal lab values, but white blood cell tends to be elevated and others tends to be lowered. But these values can be changed, depends on your individual treatment plans.
I'm going to talk some about alternative therapies. So all cancer patients are treated for their cancer usually with chemotherapy or radiation, but we often forget about their emotional problems that come along with cancer. Depression, anxiety, stress, pain, and fear of death are just a few of the things that come along with cancer. These complementary therapies can help out with those and help out with the quality of life for cancer patients. We have acupuncture, that's the pricking of the skin with needles that relieves nausea and vomiting after chemotherapy. Massage, that reduces stress, anxiety, and pain. TENS, this is where they send little shocks to the skin, usually near the area where the cancer is being treated. That helps with pain in the body. Then we have exercise. They can do Tai Chi or yoga. Tai Chi helps to prevent falls and pain. Yoga helps to ease the mind. It helps with muscle building and increased flexibility, also relaxation. Hot and cold therapy relieves pain and helps with relaxation. All of these things, they're non-pharmacological therapies that's virtually available to everyone. And if we include these in the patient's treatment regimen, then we can greatly improve the quality of life.
Okay, so resources for support. So a diagnosis of cancer really can interrupt your life. It can cause a lot of financial struggles, and it also has a lot of emotional turmoil that comes with it, not only for the patient but for the family. So we included a few resources, or a lot out there, that can kind of help you through this time. Financial resources that you can utilize. There are a lot of different organizations out here, but to name a few, there's the Leukemia and Lymphoma Society in North Carolina. They have different payment programs like Copay Assistant Program, Patient Aid Program, the Suzanne Lang Pay It Forward Program, and the Urgent Need Program. Cancer Care is another organization, and they have actually a Copay Assistant Foundation that can help you to an extent pay for different co-payments for treatments. The Pinky Swear Foundation, that can kind of help you with your upkeep of daily necessities like paying rent, utilities. It can even help with groceries. The United Healthcare Foundation, these provide medical grants that will actually help pay for treatment up to about $5,000. Then we also have your Family Reach Foundation, and that also helps with medical expenses as well as different lifestyle upkeep like mortgage, utility, and they also do this by providing different grants. Resources that you can use that are specifically to help with transportation. We have the American Cancer Society Road to Recovery, so they have a program that they have in place to help people, not just those who were diagnosed with leukemia, but other people with cancer, be able to pay for transportation or actually be picked up and taken to their treatments. Air Charity Network is a nonprofit organization that can help you fly out and receive treatment if you're going either maybe across the country or even out of the country for treatment. And then Better Health Cumberland County is actually in Fayetteville, and they have they help with a lot of different medical expenses for people who are suffering from chronic illnesses as well as cancer, and they can help you pay for transportation and gas. Family support and coping. To name a few, we have our Duke Health Caregiver Support Groups. And that is like, they have a monthly support group that you can actually go to and be a part of and talk to other caregivers about things that you're experiencing. They also have Pratt Cares, which is a really useful education tool, especially in the beginning of diagnosis, that kind of helps you along in navigating treatments and even organizations and things like that. And they also have bereavement programs in place. And then the LLS Family Support Groups and online communities. So they actually have, in the North Carolina chapter, they do have different support groups that you can attend, but if you cannot get out and go to support groups because we're all kind of, you might be short on time, they have an online community that you can also go in and chat with other caregivers as well. And here are the website links included. And if you guys were interested in any of these benefits, you can definitely either reach out to us or get in touch with your case manager so they can go ahead and start the process and get you in touch with these different organizations. And now we have Kahoot.
We're just gonna kind of take a couple of questions and see how well you learned. So we have, which of the following is not one of the 4 types of leukemia? ALL, CLL, AML, and ACL. So,
ACL.
ACL is not a type of leukemia. Which of these is an alternative therapy to help reduce nausea during chemotherapy? TENS, acupuncture, Tai Chi, Zofran.
Acupuncture.
True or false? Chemotherapy can be used with other treatment methods.
True.
True or false? There are no prior treatments given before a bone marrow transplant.
False.
After successful induction and consolidation therapy, the next phase of treatment is
Maintenance.
care and stem cell therapy, stem cells are collected from,
Bloodstream.
that's the difference between the blood,
An important side effect to be aware of during chemotherapy is
Infection.
infection. Absolutely. Which of the following organization can help with air transportation to and from treatment? That is pretty easy, Air Charity Network. Which of the following resources can assist with paying for treatment?
United Healthcare Foundation.
Good job. And our last one, you're not alone. True, super true, also true, very true. So all of the above.
Thank you for coming out. If you have any other questions, please just let us know.
Hi.